On Thursday, the Senate will hold a confirmation hearing for Robert F. Kennedy Jr., President-elect Trump's pick to run the Department of Health and Human Services. His nomination has raised alarms among health officials, with Kennedy expressing skepticism of vaccines and vowing that the incoming administration will advise all U.S. water systems to stop adding fluoride to their water supplies. Some cities have already made the move, voting to remove fluoride from their drinking water. Our CBS News Confirmed team visited one of those communities in Oregon. Lana Zach has the story.
Before water enters your home, it typically comes from a local water source, one like this, the South Santiam, which flows into Lebanon, Oregon's water treatment facility.
We pump water from this tank here to the distribution system is what carries water to the houses.
Here, water goes through multiple steps of purification.
This is the fluoride room here at the City of Lebanon. As you can see, all of the caution signs. We use a fluorosilicic acid at a dose of 0.7 milligrams per liter. So we have to wear protective clothing. You don't want this stuff on your skin.
But recently, the fluoride in Lebanon was stopped after a nearby reservoir drawdown mandated by the Army Corps of Engineers increased the muddiness or turbidity of the water. Public interest in the water supply spiked.
We had some color issues and stuff like that with the quality of the raw water.
One resident, Lindsay Pearson, began reading up on something unrelated to the turbidity of the water, fluoride.
I am a healthcare worker. I am a nurse. I'm also a mom, and I'm educated here in America. I can read articles and peer-reviewed information, and I can understand when there is a risk.
For some in the community, like Pearson, fluoride seemed like an example of government overreach. So she rallied neighbors on conservative-aligned social media channels, and they spread their message at a local donut shop.
We ended up getting in touch with one of the lawyers that was actually involved with Fluoride Action Network. He gave us different documents about neurotoxicity and different things related to our cause. And so that's kind of where the ball got rolling.
Armed with a fluoride data sheet, they pointed at studies that seemed to counter the mainstream consensus on water fluoridation.
Fluoride toothpaste.
And as the debate spread, organizations like the American Dental Association weighed in. The ADA says fluoride, which has been in use for more than 75 years, prevents at least 25% of tooth decay in children and is safe at the level of 0.7 milligrams per liter, which is the amount that Lebanon had been using. The debate went all the way up to the city council, which was also divided.
Every time somebody would send something to the council for us to have as information, it looked like sales brochures.
The town voted, and by less than a 4-point difference, the people of Lebanon voted to remove their fluoride.
I'm a firm believer in giving people their own voice and their own choice in how they focus on their health. Personally, I don't think there's a safe level for any kind of a toxic chemical in my water.
But that view was not fully shared by everyone. Sean Edinger, a former Navy engineer, voted to keep the fluoride in the water.
If you trust the government, the consensus is clear. If you run in other circles that don't trust the government, that don't trust the CDC, then obviously they're going to throw all that data and science out the window.
We put the question to dentists. Some didn't want to be interviewed because of the divisiveness of the issue, but Dr. Highfam, an ADA member dentist and Oregon State representative, says he can see clearly the difference in his patients' teeth.
I believe in it. It's a safe thing to use.
Another town he works in, Hillsborough, isn't fully fluoridated.
Is there anything that is hurting?
So in my Hillsborough office, I do see a higher number of patients that do have cavities. When they do have the cavities are a lot bigger, it's more severe.
And as the debate over water fluoridation spreads to other communities, more towns will have to choose.
Every city's just going to have to decide on their own. Vote your conscience with it. And I would hope that it goes to the people.
At the end of the day, I think people who are anti-fluoride aren't bad people. I just think that a lot of times they've been misinformed on information.
For CBS Saturday Morning, I'm Lana Zach.
It is an interesting choice for people because obviously it's in toothpaste, it's out there. I mean, you heard both sides there.
Right,
it's a decision that some people are going to have to make.
I don't know about you, but I noticed a difference when I started drinking bottled water over regular tap water. And I switched back to making sure I got regular tap water involved because cavities are not something that's pleasant.
They
but I
don't
would be,
end in childhood.
Yes, they don't. But I would be more concerned about lead than necessarily fluoride.
Without a doubt.
Yeah.
Yeah.